Welcome to the Creighton University CPHHE Mental Health Podcast. My name is Monica Lewis, and I am a mental health practitioner.
And my name is Johnny No Good.
What's up, Johnny?
Peace. How you doing, Monica?
I'm amazing today.
Okay.
So they got us here to talk about mental health and the definition of mental health. I guess I should probably look it up, instead of just spitting it out. Because when I think of mental health, I think of it in a vast kind of way.
Yes.
So if we're looking at the World Health Organization's kind of view of mental health, they say mental health is a state of well-being in which individuals realize their own potential. They can cope with normal stresses of life. They can work productively and are able to contribute to their communities. It's not merely just the absence, though, of mental illness, right? So when we look at it, we really want to look at it about the positive presence, I would say, of a person's resilience, their ability to connect with each other in the community, as well as emotionally regulate. Would you agree?
I would.
Okay.
I think when I looked up the definition, AI is like our best friend nowadays. But AI describes mental health as encompassing emotional, psychological, and social well-being. So I do think it's important to recognize the aspect of the social aspect too.
Absolutely. Actually, the psychological and social models have their own definition. So the psychological model, which is kind of based off of CBT, which is cognitive behavioral therapy, it focuses on thought patterns, the emotions, the behaviors, and the social models highlight the environmental and then the systematic factors.
Okay.
So I think when we look at it, we're looking at how, not just how that person is feeling in the moment, but how everything else is kind of influencing how they feel. And then how they're able to regulate those emotions. And it's either the resilience that they have and their ability to be able to manage those emotions that causes them to have good mental health, or their struggle with that that causes that mental health to kind of be stressed, right?
Yeah. So as far as for yourself, right? I know mental health is a broad topic. How did you become a mental health practitioner or mental wellness practitioner?
Funny. You know what? I was a social worker
Okay.
for 10 years and a CPS social worker.
Okay.
And my clients would tell me, you need to be a therapist. You talk to me more than my therapist does. And I'm like, a therapist? Like, that was never a thought of mine. I was like, no, this is what I wanted to be. I wanted to be a social worker. It was like, no, but you help me. You talk to me more. And so I went to school to get my master's and ended up with two in clinical counseling and minor in child development and psychology.
Okay.
Master's in both of those, and then in chemical dependency as well. So I'm a licensed independent mental health practitioner, and I've been practicing now for like 22 years. I love the work that I do. But if it had not been for those families and me just taking the time to figure out what was causing what, I wouldn't be here today.
22 years, huh?
22 years?
Yeah. That's amazing. That's super
amazing.
dope. Listen,
you.
I think that's kind of the same way that I kind of got interested into mental health too, but a seed was planted. So my little brothers, they had a therapist. And at the time I was going to community college, taking some psychology classes. And he was like, man, I really think that you should look at becoming a psychiatrist or, a therapist or looking at some type of aspect. Me personally, psychiatry, no disrespect to nobody. I feel like we can go other ways besides just hurrying up putting people on pills.
Right.
And there's different ways. Like some people do have the chemical imbalances where they definitely need their meds and they should take their meds according to the prescription. But I think that a lot of the factors that ail us got to deal with missing out on what I would call purpose. So when I look at my approaches, the things that I like to look at, psychoanalytics got 3 different levels to it, right? You got the Freudian, which is all about the pleasure. You got Adler, which is all about power. But I like the Franklin approach, which is all about meaning. So I think that when your life lacks meaning or lacks purpose, it's hard for you to see value in who you are as a person. So a seed was planted by my little brother's therapist. And my best friend, she asked me a question in April of 2022. She said, "Where do you go as a black man?" And I told her, "In my blackness." And she didn't know what I meant. But shout out to Dr. Rita Walker. She wrote the book, The Unapologetic Guide to Black Mental Wellness. And so now I got more of praxis. I got more verbiage, more language to be able to, go in on that point. But I kind of got pushed into it by other people around me as well. So it's dope we got that in common.
But it seems like it was natural. It was already in you.
Yeah.
So they planted the seed, but it was already there.
That part.
Yeah.
That part.
Okay. You said something about psychiatrists and the push for medication instead of trying to really get down to what's happening. And I think that it's important for people to understand that we have like different levels. So you have the psychiatrist, the one who writes the prescriptions and manages those medications with the person. You have the mental health practitioner, or the psychotherapist, the one who their job is really to kind of dig a little deeper to figure out where these problems are coming from. Like what is the root of these symptoms that the person is having and trying to balance it out. And so that's when those other forms of or modality of treatment would come into place for us to be able to kind of utilize those to kind of figure out how to kind of help that patient a little bit better, be able to manage those symptoms. Because what you said is right.
Right.
It's not something always that a pill can fix. Sometimes people can be hurt so deeply, that they have a soul injury. And we have to be able to figure that out and help them process that out in order for them to even be able to see beyond just at the moment, beyond the past, into their purpose.
That part.
So purpose isn't even in their sight because they're so busy in their injury.
That part. And I think you got like a unique experience that seeing that you were actually licensed as a drug and alcohol counselor as well. And so you can see like how these things overlap as far as addiction and, depression and anxiety and all of these different areas. So I think that is dope that, as a mental health practitioner, you able to see the different modalities and then figure out which ones is best for your clients. So how long, you said 22 years, in your 22 years experience, like what has been the perception around mental health or what's been some of the biggest misconceptions around mental health and what it is and what it's not?
That's such an excellent question. And I think you probably can answer that as well.
Yeah.
Just from the amazing work that you do, I think it's still the stigma.
That part.
Don't you think so?
Yeah.
It's still the stigma, trying to get people, to really understand that mental health is not rare. Mental health doesn't mean that you're crazy.
That part.
It doesn't mean that you need to go hide in the room or don't tell anybody what you're going through.
Right.
Just to allow them to recognize that everybody has something. But it's when that something takes over your life that it's the most concerning.
Okay. Yeah.
Everybody has something. Nobody was born to be just perfectly normal. And if we say that we is, something wrong with us.
That part.
I know you turning that tissue a different direction. You got to have something just this way. You know what I mean?
Yeah.
We always have something. But it's when it gets out of control.
Okay.
You know what I mean? That we find ourselves really needing someone or something to help us.
For sure. So I definitely would agree with you. That's the reason why we named our grassroots organization and movement Beyond the Stigma, because I feel like a lot of times that little misconception about it, what it is and what it's not, is such a barrier to people even seeking help.
It is.
And then we feel isolated in what we're going through. But for me, I feel it's important to also recognize that there is some legitimacy as to why there are fears around the institution of mental wellness and mental health.
Absolutely.
I think about Samuel Cartwright in 1851 coming up with the term drapetomania because Black people desired to be free from slavery and saying that we had a mental problem for desiring freedom, or how they came up with terms like heptitude, saying that we had an innate desire to be lazy and to destroy the property of the slave master. So I do think it's important to see that when I look at our history in totality. I even think about Malcolm X's mother and how she was placed into an asylum and stuff like that, about dealing with post-traumatic stress syndrome and all these other different things she had going down, and had a mental breakdown. So I do think it's important to address some of these misconceptions, but then also normalize these things so we don't feel like we're in it alone.
Absolutely.
So being that you have had 22 years of experience in this field, what are some of the common mental health disorders or mental health problems that people face, or challenges that people face?
Well, I think you named a couple. I think the most common that people don't recognize that they're dealing with, if we were just to look at those, it would probably be depression and PTSD.
Wow.
You know, PTSD especially because depending on what community you're in, and looking at our community, we go through so much at so many different times. And so because of that, we don't always even recognize that something that we saw or something that we've been through has left an impression on us. We just know that we're responding to something. You know what I mean? Say, for instance, we had a young man in the community that had been killed by the police.
Yeah.
Other young kids went to school with him. You know, other young kids drive.
Right.
Other young kids, you know, do normal teenage things.
Right.
They didn't want to go to school.
Mm.
They didn't want to drive.
Mm.
I had a couple teens call me and say, Monica, I don't know what it is, but I can't get up. I don't want to go to school. I just don't want to go. What's wrong with me? You know, when I'm outside, I'm looking around.
That part.
You know what I mean?
That part.
I'm checking everything. I'm trying to make sure that I got everything before I leave the house. I don't have anything left in my car. A sense of panic.
That part.
That they feel.
That part.
You know?
That part.
Increase of anxiety. They're not able to sleep. You know? They're waking up, you know, having nightmares. And they're not understanding why. Not understanding why.
That part. And I think you hit on it, because I definitely was thinking about all of the different anxiety disorders. I think about depression. I think about PTSD, and how a lot of times they all intersect. So I know you mentioned about the young man who was taken. And, you know, of course, that's PTSD on the people who he was around, his loved ones, his care ones. But then it's also anxiety. And I think that, you know, when I look at depression, I would define it as concern about things that have already passed, and anxiety as concern about things that may or may not happen in the future. And I looked earlier, and we just tragically lost another man who had lost his life at the hands of the police. I saw on Facebook yesterday, a bunch of police officers had jumped on this man and ended up taking him to prison. I seen on the news earlier today that man actually succumbed to his injuries, and they found him unresponsive in his cell where he passed away. The same man from the video. And Dylan, as I have dealt with PTSD from watching my cousin Amir Locke get killed by the police on camera, it's something, it does give you a sense of anxiety. It does trigger PTSD. It does make you depressed, especially if you feel hopeless or powerless in your position to make a change or be effective in changing things that's going on around you. So I love the fact that you highlighted that these are things that are real problems and unfortunately too common in our community.
They are. They are. I'm sorry about your cousin.
I appreciate that.
I was not aware that someone else had been taken yesterday.
And I mean, the man was hollering in the video. You know, we had people who was around responding, but he was hollering, and I couldn't tell. It was inaudible, but I think he said, y'all are killing me. It was like 12 officers jumping on this man. There's no reason that they should have been responding with that amount of force to somebody who was accused of burglary and driving without a valid license. So I just think that these are issues that have been not only in the present time, but a historical context. When I think about the patty rollers and I think about the overseers and just some of our unique experience with some people unofficially called post-traumatic slave syndrome.
Absolutely. 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 But just even with us talking about it right now, the effect that it had just on you and I.
Right.
And so imagine the kids, imagine the teenagers, imagine the parents, imagine the siblings, and everyone else that have not just indirect, like we just had,
Right.
but direct, the direct impact
Right.
of them every day. Now you go home and you don't have this loved one anymore,
That part.
you know,
That part.
and you have to hear about it. You have to see it on TV.
Right.
You have to see it on Facebook.
Right.
You can't even scroll if that's something that they did on social media. So they're constantly being re-traumatized by that same thing.
That part.
And we don't even look at it as, at least, most people don't recognize it as a re-traumatization. They just look at it as news. But this is somebody's life.
That part.
Somebody's child, somebody's baby. So
That part.
yeah.
So as far as, dealing with being re-traumatized and, some people would use the word triggered, dealing with different triggers as far as being effective of social media as a mental health practitioner, what kind of tips do you have for people out there for maintenance? Because I do think that mental wellness is something that has to be done over and over again. And then as yourself being a person who people come to, what type of tools, tricks, advice can you give about mental wealth maintenance?
Well, I tell everybody, unplug. Unplug. Because just like I said, when you get to scrolling and you're seeing all that, it overstimulates you. Unplug. Unplug it. So definitely steer away from those things for a while. Give yourself a break, at least a month, especially after something like that. In terms of just everyday mental maintenance, making sure that you live with gratitude. A lot of time where people are focused on what they don't have versus what's present in front of them.
That part.
Speaking positive within themselves every day.
That part.
I teach that a lot. You want to make sure that you're doing those positive affirmations in the morning or at night or both. Relaxing your mind, take a nice, warm shower before you even get ready to go to bed, to put your mind at ease.
I think I'm sorry.
No, go ahead.
I think that
I got a list.
I think affirmation is another one of those words that can become kind of like a buzzword. Like, what is the importance of not only positive thinking, but positive speaking over oneself?
You answer that.
So I think for me, right?
It's on your tongue. I seen it.
So
Go
have
ahead.
you ever heard of the rice experiment?
I have.
Okay, so when I think of Dr. Emoto and him demonstrating how water crystallizes in different forms based on if a word that's given or a label that's put on top of this rice, if it's a positive label versus a negative label, the rice could spoil faster. So I think that it's important to understand as beings that are 75% water, the thoughts that you say, the words that you speak over yourself, like you are literally casting a spell that can change you at the molecular level. So I think that is super important to not only say positive things about oneself, but to think positive things about oneself. But I think it has to get back to the basis, right? What you think about yourself is based off of what you feel about yourself. And what you feel about yourself is based off of what you know about yourself. So you have to go and explore and put yourself into a position to know how greatly and divinely made you are in the first place.
You do. And once they get into that depressed state of mind and they start that negative thinking, it begins to sink them down into a deeper hole.
That part.
And so everything, see, that always happens to me. Nothing ever good comes my way. All these negative things began to kind of overlap, sinking them further and further down. And so to try to pull them back up, you have to reinforce what? The positive.
That part.
You have to reinforce the positive. You have to try to do reality testing on the negative. Does everything never goes your way? So nothing ever goes your way.
That part.
It always happens like that.
That part.
So we have to kind of challenge those unhealthy thinking styles so that they can recognize that it is the unhealthy thinking styles that are causing that low mood. Going back to what you said about just the negative statements to oneself. No, you have to watch what you think, because what you think becomes words, right? And we have to watch what we say, because what we say becomes action.
That part.
And we have to watch what we do, because what we do then what? Determines our destiny.
That part.
So when you think about it like that, and you really think about the labels that we put on ourselves, which goes back to the stigma, I always tell people when they come in for mental health services and they ask me, so what's wrong with me? And I say, do you want to know the diagnosis or do you want to know what's wrong? Well, I want to know what you're diagnosing me with. Okay, well, I'll give you the diagnosis. I'll give you the name. But I'm more concerned about the symptoms.
That part.
So the label is what causes the people to want to shy away from seeking services. But if we just said, when you go to the doctor because you're coughing, you just want to stop the cough.
Right.
They tell you what's wrong, but you really just want to stop the cough.
That part.
When you got a headache or the chills, you want to know, do I got flu? Do I got COVID?
That part.
What's wrong?
That part.
So when you come to me, I want us to think about it in that same way.
That part.
Let's look at these symptoms and let's figure out how to manage those symptoms. Okay. What's that? Oh.
We already did.
Got it sideways.
Yeah. But we already did. Yeah.
I didn't get a chance. Can you tell me more about what it is that you do? I'm so interested about your work with Black men mental health and all the services that you offer for them.
Yeah, so it's an intergenerational peer support group, almost like AA for mental wellness.
Okay.
And so it was started, like I said, based off of a conversation with my best friend. She asked me, where do you go to feel safe as a Black man? And when I thought about like the spaces that we don't have where we could feel vulnerable, feel seen, feel heard, and still not feel less than, I'm like, I want to do that for my birthday. So for my 31st birthday, I created this space. I put out the call and brothers responded. And originally when I did it, I wanted to do it in partnership with professional licensed therapists. And we couldn't get nobody to be a part of it. And I'm like, all right, one event, I'm like, I could commit to a year because the response was so great. The year came and gone, and I'm like, all right, I can commit to 2 years. You know what I'm saying? Because the response was so great.
Right.
And in September, it'll be 3 years.
See?
So we've helped almost 200 Black men by providing them a space. We meet the last Saturday of every month. It's kind of open style. So just kind of what's going on. And I was just doing some research. I'm taking this research methods class and they had us research people who kind of doing stuff similar in our field. And I was looking up a sister named Stephanie Roberson. And she's a part of NAMI. And, she was describing kind of what's some of the best practices, some evidence-based practices of how to, get people, particularly Black men, to engage in conversations around mental health. And it's stuff that we already been doing from the beginning. So before we
naturally.
Yeah. And I was going to say, before we hopped on and started recording, you was like, don't let education level or anything like that deter you, because lived experience can put you on par or exceed people who have the academics. And I think that that's the beautiful part between getting theory and then being able to apply practice. And so we've been doing that for close to 3 years now. It's been a beautiful experience. And so I'm just looking to continue to do the work.
Yeah. Good for you. It seems
Thank
like you're doing a good job.
Thank you.
Right. Well, they didn't left us.
Yeah. They got up out of here. So they done got up out of here on us. Yeah.
But yeah, I definitely think that, when I look back on just my, my years of experience and education and, all of the theories, even with Gestalt, you didn't mention Gestalt.
Yeah.
I'm going to tell you, I found the work that I do to be so different
Okay.
because every person that walks in the building, even if they have the same diagnosis, got a different story.
That part.
They got a different story.
Mm.
And so everything has to be tailored to that particular person to meet their needs, you know? And I enjoy doing that because that means I'm having to take pieces from this and that and this and that and building a good treatment plan in order to work with that person directly to help them. So that's the part that I like the most.
That part. That's super dope. That's super dope. And I love how, you know, something that you was describing before in our previous segment, you were talking about like when somebody comes to you and they're asking what's wrong, how if you went to the doctor, they would tell you that you had a cough or you had a flu, but a person wouldn't identify with being the flu. So I think that that's a part of the misconception, some of the negative stigmas around mental health, that a person can experience depression without being depressed or without being depression. You know what I'm saying? So
depression is normal though.
that part.
You know, there's some levels of depression that's normal. We all can get sad.
That part.
You know, that's natural, right?
That part.
It's the beyond sadness. You know what I'm saying? It's the moments of depression that you can't leave the house. You know, where, you know, they've got the windows and the doors shut, the lights are off, and they're just in the house for days at a time. You know, they're not cleaning up. They haven't bathed. They haven't showered. You know, that's a different type of depression.
That
you
part.
know? And when that goes on for a period of time beyond 2-3 weeks, then we need to be looking at it. What's happening? What's going on that's triggering this?
That part.
You know, people can have a breakup and be depressed. And they can be depressed for a month.
That part.
But it don't mean that they lose in themselves. It just means that they're heartbroken and they're depressed. And they probably do need to talk about it. But is it the clinical depression that, you know, that's going to stop them from being able to live their life for a long period of time? Maybe not.
That part.
If they stay in that place, though, it could.
That part.
You know?
That part. Yeah, no, I'm right there with you. Those are definitely some of the early warning signs that listeners, viewers, people can be on the lookout for.
Right.
Especially if it's a change in normal patterns or behavior. Check on your strong friends. You know, if you notice that your friend is being more isolated and not wanting to be as involved in things that they love to do, they not as responsive to group chats. They unkempt. You know, the hair is getting a little cut. They struggling. And I mean, sometimes I think it's a term called the spoon theory. And I love that because like just getting out the bed might take all 5 of your spoons depending on how severe your symptoms are that you're experiencing. Just taking a shower might take 2.5 of your spoons depending on what kind of problems and diagnoses that you're going with. And so I do think that it's important what you mentioned, which is some of the early warning signs. So I guess we about to be getting ready to wrap up here.
Oh, right.
We about to be getting ready to wrap up.
We done went into a whole nother segment. Segment on depression.
Yeah.
Stay tuned for that.
Yeah. But I think it's such a, like you said, there's so many different levels to it.
Yeah,
I look forward to you deep diving more into it, and you know,
it.
me supporting the conversation how I
you
can.
deep diving with me, so
yeah. So
We
as
having a
far
good
as leaving out, is there any type of statistics or any type of numbers that you want to leave our viewers with, just to help them understand how common some of these things are?
Absolutely. I think one of the major myths is that what I had said earlier is that, you know, people who have mental illness or have a mental health disorder are rare. And that's not true. 1 in 5 adults suffer from some type of mental health disorder. And so don't ever think that you're alone in that. And just because there is a name for something does not mean that that's you. So always seek help, always talk to somebody, and know that there is someone available for you, whether that is coming to see a mental health practitioner or joining Johnny's
the men's group.
men's group.
Yeah.
Yeah. which I was gonna call it. It's kind because it's a support group.
It is.
It's a support group.
It is.
His men's mental health support group. Dope.
Yeah, thank you.
You are welcome. You are welcome.
Yeah, so
that's it for today.
I think that's it for today. Make sure y'all hit that like button, hit that subscribe button, drop some comments. Let us know what's some of the topics that y'all would like for us to discuss. I mean, it's not every day that you get a licensed professional, well-knowledged, who can help you explore these different topics, because sometimes, hey, treatment be costing. Everybody ain't got insurance, you know what I'm saying? So, hey, make sure y'all hitting up them comments.
But there's a free health clinic.
Yeah.
NOAA.
Yeah.
NOAA Health Clinic, when we offer free, health services at NOAA. So you can always go to NOAA.
That part.
Mm-hmm.
That part. Yeah. And I think that's the important part, is knowing what resources are out there. So
absolutely.
Miss Monica Lewis is a resource. NOAA's a resource. And holler at me. You know what I'm saying? I ain't gonna send you all the way on the road.
Right. He's a resource.
Come holler at me. So thank y'all again for tuning in on the first episode, and we look forward to the next one.
Absolutely.
All right. Peace.
Peace.